How difficult is it for someone to recover from addiction?
The timeline for somebody to recover could be anywhere from 6 months to 5 years. It's really a lifelong journey. The root of an addiction is, a chronic brain disease. And not only is there, chronic brain disease and trauma and things like that, but the result of addiction is usually that there's been compromises and challenges created in other aspects of life, whether it's loss of job, loss of family. So you have addiction as this, brain disease, rooted in a brain disease, usually prompted by some kind of trauma, which then compounds all these other aspects of an individual's life. So that process, that journey of recovery really needs to take into account all those things.
Sure. Are there factors that will help with recovery?
A strong support system, family, friends. But I think what the other things that we can't ignore are that as somebody's going through their recovery journey, they need access to the basic needs that they have as a human being. They need food, they need shelter. It's not possible to recover from any disease, right? If we don't know where we're going to live. The other thing that can't really be understated either is that the process of recovery, I think what's important is that folks have a sense of what is their chosen valued role in life, and that is the driving force and motivation behind their reason for recovery.
Sure. So do you have advice for a family member who's trying to get a loved one into treatment?
So I think what's important is that at the core of trying to get that person help is that it comes from a place of love and a place of understanding, and that means at times that we may need to set some firm boundaries and really know the limitations and how we might be codependent with that individual and how we might be enabling their behavior, and those are really difficult things for folks because it feels like I could be abandoning, my loved one, who's struggling, when in fact that relationship is exacerbating, their use. Maybe not their intention, but it's certainly the function of that relationship.
Great. And then when a person is in treatment, what do you do then?
Same thing. And, being involved though, there's a lot of the really good treatment programs will have individuals involved in care, whether it's groups. So entering into their own treatment, being involved in family groups, going to Al-Anon and family groups. Those are things that people can do to remain well, and getting involved in the recovery network that, wherever they might be, and getting connected with other family members, through Al-Anon and so on.
So anyone can go to Al-Anon? Is that it? Like, if you have a family member, the family member doesn't have to be in treatment if you're just concerned?
No, anybody can go. It doesn't matter, irrespective of treatment, just like going to AA. So there's these family groups that people can go to, and it could just be a good way for somebody to get some insight, and sometimes that's the first step. Maybe the individual that is struggling with addiction isn't ready to do what they need to do to get well, but the family member is, and they can start by doing things like that and gaining insight and so on, and oftentimes that will help to create that system and that support that I was saying that can really help support that individual and kind of get them to where we hope that they need to go from a treatment perspective.
Can you tell me some of the programs Oaks has for people who want to go into recovery?
Sure. We have everything from traditional outpatient, intensive outpatient treatment, including medication-assisted treatment services, which is an evidence-based practice, all the way to community care like our STAR program, which helps individuals in the community, providing case management and peer recovery supports to help people with all their environmental needs, and maybe helping to support them in getting back to work, back connected with family, or in some kind of educational program. Another really great program that we have is our opioid overdose recovery program, where Oaks actually provides bedside intervention to individuals who are experiencing an opiate use disorder and find themselves in the emergency department. So we have peers that do bedside intervention and help individuals in that situation get into treatment immediately.
Wow. So for me, a regular person, if someone needs help, how do they access those programs that Oaks has?
Sure. So we have a 1-800 number that folks can call. We have individuals that are ready to take your call and to triage and get you connected with care. We also have on our website a form that folks can go ahead and complete, and they can send that in, and they'll have a response provided to them, and we'll set them up for an admission appointment. Otherwise, we have certain facilities like our facility in Trenton. People can just walk in when we're open, or our urgent care centers. People can just walk in at any time when we're open without appointment being necessary and without calling ahead.
Wonderful. Thank you so much. Thanks for all the work you're doing.
Absolutely. Thank you so much for having me.